This is Monica Perez here with our returning guest and personal friend and friend of the show, Lanni from Greener Postures, to talk about something that is squarely in her wheelhouse, her knowledge base, and her own personal experience home births. Hello, Lanni. How are you?
Hey, I'm doing good. Thanks for having me again. I think this is like my fifth time back
Yes, I
on
was
your
thinking.
show. So, yeah.
If you ever have a topic that you know about, you have an absolute open invitation. And in this case, what prompted this is I do a newsreel on Tuesdays and Thursdays, and I just pick stories I find interesting. And one of them was about how epidurals supposedly what they give a mother to numb in her lower back so that she can't feel childbirth saves lives. And although it didn't say it, looked in the article like they were just trying to promote it in the UK because they want to sell epidurals. But I
Hmm.
thought, well, I mean, that's just one thing that might weigh in someone's decision not to have a home birth, because that's definitely not something you do in a home birth. Well, you
Correct.
showed up, you know all about it. You've had a home birth. And I just, I have my own concerns. I've had my own experiences. And I mean, I don't know if they would have been better or worse with a home birth. I want to tell you about it and see what you think. But let's start with just, you're interested in the topic. Why did so you've had
I've
two
had
sons.
two births, and my first was in the hospital, and my
Right.
second was at home.
All right. So
So I have
why'd you even
both
think of a home birth?
sides.
Yeah. Why'd you even
Yes.
think of a home birth?
So initially, for my first, I didn't think that it was possible. I thought I'm on the heavier side, maybe my blood pressure. My doctors made me feel like it wasn't possible. So it was just not in my line of thought. But I wanted to have a natural birth in the hospital because I really had this gut feeling that the human body is actually made to do this. It's a normal bodily function. It's the reason why we have been able to exist as a species. So I did a lot of research at that time. This was in 2012 and 2013, reading books by midwives that did home births and understanding physiological birth and what actually happens to the body during this transition from baby being inside to baby being outside and recovery. So I had an idea of what I wanted for my first birth. And when I went into the hospital, I kind of realized that that's not really possible in that setting because of the rules, regulations, and things that they have in place to keep birth moving along and turn beds. Kind of like turning tables at a restaurant. They want to turn beds, and they are working for the insurance companies, not only your insurance company who's paying for your visit to the hospital, but their own insurance companies that's covering them their liability as a doctor. So there were so many things that are just the status quo. If you're not progressing at this specific timeline, that they're going to start with interventions. And that's something I'd love to talk about today is what some of those interventions are and what some of the downsides to those are, and how they can cause further complications. So then when approaching my second birth, we had a nice nudge because I found out I was pregnant in March of 2020.
Yeah,
So
that is
yeah,
crazy.
and that's when we really started communicating. Actually, at that time,
Yeah, you and I,
I
yeah, uh-huh.
I was listening to your show and I was like, I've been listening to you talk about this before it was really starting to unroll. And I was like, I don't want to have my baby in a hospital in November because I know this is happening. And you're like, oh, November will probably be fine by then. Like, and I thought,
Yeah, I didn't
maybe
think.
is
Yeah.
this just another swine flu or whatever else, where they talk about it for a while and then it goes away. Well, it wasn't. And so I was fortunate enough to have midwives in town that I talked into coming to the home birth. They were normally delivering in a birth center, which is like nearby a hospital, but it's like more of a home setting and it's just with midwives. And then they did previously do home births, but during 2020 they were trying to limit that. But I let them know that it was really important to me, and we were able to do that, and it was a beautiful experience. So yeah.
So you did a birth center?
I did not. No.
Right,
That's where
okay.
they were trying to get me to go because of
Right.
COVID stuff, but I talked them into coming to the house.
Got it, okay.
Mhm. Yeah.
Yes. So why did you want them to come to the house
Well, I
instead of
thought
the
that
birth center?
because it's a natural process of the body. I felt that the more comfortable I was, the more safe I felt, and the less invasive the space was, the better chance I had of having a natural birth. And I was absolutely right because it was a completely different experience.
Okay.
Yeah.
So what what were you why did you not so your like, for the hospital birth, I feel like for me, the number one worry is what they do to the baby when the baby's
Mhm.
out. So, I know they take footprints, I believe they take a fetal ketonuria test, which is basically a blood test, and I'm sure they store that information. They are probably just ready to jab the baby with vaccine
Mhm.
like day 1, and I just that's the kind of thing that I worry about because you really aren't necessarily gonna have total control or even be there if there's any kind of stress or complication, they might take the baby out of the room.
Yeah, and even under the best circumstances, you're in an altered state during labor. That's what your body
Right.
is designed to do. So you're not in a state where you can defend yourself or advocate for yourself, and it can be really scary when you're in that machine. Those people, they not necessarily as individuals do they know they're doing anything wrong. They're just moving forward with this, this
Yeah.
machine that is supposed to operate the way it is, and it was everything that I thought a hospital birth would be. It was
Yeah.
just that. It was just moving me through a conveyor belt.
And medical malpractice insurance is totally goes hand in hand with following protocol.
Absolutely.
That's how you make sure that you're covered
Yes,
by
and
your
so if
insurance
you
company.
want to look at it from a doctor's point of view, if they do less intervention and then something bad happens and you were to sue them, in court, it can be proven they didn't do everything that they could
Yeah,
have.
yeah, that's a good point.
So they're always wanting to try to do
Yeah.
more intervention to be able to prove that they did everything possible within their power to help you if there is an event that goes wrong. Because things go wrong. Like birth is touchy, life is touchy. You can die at any stage of life from a fetus to 105 years old. It's just accidents happen, people get sick, there's, unusual circumstances. So there's risk in everything. Minimizing risk is important when you're looking to take on something that you have any kind of control over, and minimizing risk for me was to not be in the hospital because of all the interventions that are possible and the risk that comes with those.
And what were you worried about as far as having a home birth? What were your biggest fears there?
I think that, like, there's so much propaganda in the media of what childbirth is like. I mean, even back from, like, the Cosby Show, the woman screaming and hitting her husband, "Why did you do this to me?" All of that. Um, Postpartum hemorrhage was what I was afraid of. Do women just bleed out after birth? Is this a really common thing? And it's not. Yes, there's bleeding from birth, but you've also doubled your blood volume to make the baby. So you have a little extra blood to let go of at that time, which is fortunate. That was that, and then the baby, would they take their first breath at the appropriate time, and would they be okay? And then there's also all of these, like natural things that kind of carry the baby out of the womb. They're still attached to the placenta for a time. They're still getting oxygen from your blood for a time. So if you don't cut the cord immediately, they can take a minute or two to get their first breath and be just absolutely fine.
Yes. Okay. So why do you think that I mean, what do you think are the biggest what's the fear mongering that comes down from the doctors? I know, like, I asked you to listen to somebody's story,
Yes. Yeah.
and the doctors were worried. The mom had preeclampsia, I think.
So what I listened to and what I heard is something different than you heard. This is
Okay.
really common. So preeclampsia is pre-eclampsia. Eclampsia is its own thing. And most people
Right.
don't even know that, right?
Yeah.
Preeclampsia is just um gestational elevated blood pressure, right? Hypertension. So if
Right.
you have a high blood pressure during the end of your pregnancy, they could call it preeclampsia, and it is sometimes accompanied with protein in the urine, which would show
Yeah.
kidneys not functioning well,
Mhm.
right? So then they are worried it'll lead to eclampsia, and eclampsia means seizures during pregnancy or postpartum. And you can get
Mm.
preeclampsia at the end of your pregnancy.
Mhm.
You can also get it postpartum. Up to like the first 6 weeks, you're still at risk for having a sudden spike in high blood pressure, which can lead to seizures, and as well as other complications like blood clots or heart problems. So
Right.
it's
Okay.
serious. But not every woman has slightly elevated blood pressure
Right.
at the end of their
Right.
pregnancy is going to have that, and not every woman's gonna have the protein in the urine, not every woman is gonna end up having a seizure. So this person, his wife had a seizure, after, but she had been tested for preeclampsia during her pregnancy and had not shown any signs. So
Oh,
this
okay.
was completely out of the blue and would not have
Right.
been any different if she was in the hospital setting,
Right.
except that she wouldn't have had to transport to the hospital after her birth.
Right.
Yeah.
Right. And could they even help her in the hospital? Like, I'm not sure what they did.
They'll restrain her and give her whatever they give people who are having seizures.
Right. Right.
Yeah,
Okay.
and that's it. So, she was fine. So,
Right. Right. Yeah.
yeah. So, but there's so much propaganda out there that's like, birth is this situation unlike anything else where you're just gonna die. It's just gonna be over. There's not
Yeah.
any signs that it happens, just everyone dies. And that's not it's not how it happens. Like there's a lead up to that, and there's a lot of room to choose to transport to the hospital if you want to, assuming like most people, they're within 15 minutes of a hospital.
Hmm.
And when you have a home birth, they have state regulations and they have insurance and all of those things. So they're kind of uh, hospital adjacent. They're just like they're bringing some of those same things. They have an oxygen tank, they have Pitocin, they have other kinds of medications for the babies and ways to resuscitate and training, and they're nurses. And they also know the signs to look for to send you to the hospital. And I think that that can be good and bad. That can be good because if you're in that situation, you really need it, they're there. It can be bad because they're also programmed with the same fear
Right.
that everybody else is, and they're looking for the bad and scary things, and they might be reading into something and, better safe than sorry, where you're getting shipped off to the hospital when you don't really need to be.
Right. And they're going to prefer that solution if there's any risk or any perceived responsibility on their part
Right,
is
because
where
they're
it comes from.
protecting themselves and their career as well. Yeah.
Okay. So I have a lot of different like personal experiences and anecdotes that although I mean I didn't really think very hard about the possibility of a home birth. I wouldn't I wouldn't avoid it unless I felt there were high risk factors.
I
So, yeah, go ahead. You go.
Can I ask something about your
Yeah.
first pregnancy?
Yes.
Were there any indications that you were having anything except a normal pregnancy
Right.
during
No,
that?
as a matter of fact, I got sonograms and I didn't even want to get the sonograms. They were inaccurate at the time. It was
Mhm.
right before they came out with the new ones that were highly accurate. And now I would not actually get sonograms at all. But at the time, they were not only sonograms, that they were inaccurate. And I said to my husband, like, that I don't want to do this because if I get a false negative, if that someone tells me this kid there's nothing wrong with him and there's something wrong with him, that is the only thing I'm not going to be able to handle. And that's exactly what happened.
Wow.
Yes.
Yeah,
And
so I've
yeah.
thought the opposite. I've always like, if I had one and it said something is wrong for me to worry this whole pregnancy and then
Yeah.
have it be
Well,
fine, like, that would be challenging as well, you
that's
know?
actually probably much more common than
Mhm. It
and
is.
it results in many abortions, in my opinion.
Yes, and that's what's super sad about it.
Yeah,
Yeah.
because I've had several people, I mean, I would say 3 or 4 people tell me that they were told that there was something wrong with the baby. They had the baby anyway, and there was nothing wrong. And then I had a good friend who was told there was something wrong with the baby, didn't even leave the hospital before getting an abortion. So, yeah.
And you don't
And that
know.
you don't
Mhm.
know,
You
right.
just don't know.
So, go ahead, and then I'll tell you a little
Sure,
detail about that.
your situation is really interesting to me because I don't know anybody else who's had a baby.
Yeah,
Because
well,
that is what they screen for it, they find it, and they're, like,
right.
being eradicated as a people. And
Yes,
when I
I
was
it's
kid
genocide, the only
Yes,
genocide I ever heard of.
exactly.
They give you
And
a gene test and
when I was a kid, I knew other,
right,
kids that had siblings that had Down syndrome,
right,
but now as an adult, I don't see them, around as often,
right. Because it's
and,
1 in 400, it used to be,
wow.
and now it's
So,
nowhere near.
now it's no. Yeah, so you have to think, like, would I have an ultrasound? And if I was pregnant again, probably this time not, because would it change my opinion on what I was going to do? And I would absolutely not terminate a pregnancy
Right,
regardless. I would see it
right,
through no matter if they told me it wasn't going to be viable, you see that through.
right,
So,
right. Oh, I agree totally,
yeah.
yeah, that's the you just
So
have to take it as it comes.
You did end up having, an ultrasound for
Yes,
that
so I had
pregnancy.
ultrasounds, and my fear was that the umbilical cord would get wrapped around this baby's neck. So I
Mm,
never had a baby before.
uh-huh.
Like, I just didn't know what to worry about, but
And
I
that's
worried
something
about
you hear
that.
about in the media and,
Yeah.
like, it's a scary thing, yep.
So I asked somebody to get the sonogram. I was like, "Can you tell me if the umbilical cord is at risk of strangling this kid?" And
Mhm,
he just didn't answer my question, and at no point did he respond to my question, which I realize in retrospect was a tell, and I'll tell you why. So at the time, he said, "This child does not have Down syndrome," which was super annoying. He said that to me, and so I absolutely banked on that. Although when I look back, the baby's head was like off the charts small.
mhm.
So it was like below the 3rd percentile. They don't even measure it below that. So he had a little teeny, like a tiny little
Aw,
brain. And the reason he couldn't see the umbilical cord is because it was only 5 inches long.
wow.
So when then I think like a month early, so here you would know that there were problems. My water broke like a month early.
Okay.
And I had a great doctor. So he just said, like, just lay in bed for a couple of weeks and the baby will like accelerate in development because of the stress. So when I finally did have the baby, then after a while, the like risk of infection goes up if you have a like a broken sac, whatever.
Mhm.
So they induced me with Pitocin,
Mm.
which they did to my mother when I was born, and her uterus ruptured.
Oh, wow, okay.
Yeah.
Mhm.
So like
So
I
you
was
know
like,
about those side effects that I
I
was
don't
gonna
want
talk about today.
Pitocin. Yeah, it happened to my mother like 5 seconds after I was born. And
So
she
you were
really
the last child.
yes, but you don't
Yeah.
give a 40-year-old woman having her ninth child
Had she ever had a
Pitocin.
cesarean before?
No, no, no
No, all the
cesareans.
kids
There were no
naturally.
cesareans. No, no.
Still a ruptured uterus, that is one of the side effects, and that could be
Yeah.
deadly, that's horrible.
Well, yeah, she lost more blood than was in her body because
Wow.
they were giving her blood while she was losing it.
Oh my gosh.
So, and they had to use the IV that was giving her the drugs. Like if she hadn't had the IV in there already, they wouldn't have been able to
To
like
save
get
her,
in there.
yeah.
So I was
Wow.
super scared of Pitocin.
Mhm.
And it was like a totally, rather unpleasant experience. You have to have an epidural with that, or I would say because it's so painful.
I didn't.
And you didn't? You got Pitocin?
They gave me Pitocin in the hospital because I was taking too long and I
Oh
was
my gosh,
stalled.
was it insanely
It
painful?
was so intense, it was the most
Yeah.
intense thing that I've ever
No,
gone through, yeah.
I want none of that. And
Mhm.
so when the baby was coming out, he was in distress like the whole time, which nobody knew why. And they kept like somebody ran in like they with an emergency thing to do a C-section right away. But I had this great doctor and he was just like, let's just calm down. And he got the baby out, even though he had only a 5-inch umbilical, because then they knew
Mhm.
why he was in so much distress, but he got him out
Yeah.
and he was fine. Like I mean, I was devastated because he had Down syndrome, but he could
Yeah.
suck, he could breathe, his eyes were fine. He was great. It was great.
Aw.
But I had that one good doctor. Then I've had other
Yeah,
experiences
that yeah, where you have the opposite
where
and you just
yeah.
yeah, and you sometimes you think these people are great and you don't know until you're in that position where you're
Oh,
vulnerable.
yeah, the reputations of my 3 different doctors did not correlate with my experience with them.
Mhm,
So this guy was
absolutely.
just fantastic, really, really great, and, but maybe so if I talk to somebody like, I had a friend who was 44,
Mhm,
and she was pregnant, and I don't know how many kids she had, quite a few, and I said, "Look," she wanted to do a home birth, and I said, I would be a little worried about that," and she didn't wanna hear it, but similarly, her baby came so early,
mhm,
she had so many problems that they actually took the baby out with a C-section at, like, 4 he was 4 pounds, he was 4 pounds.
aw, yeah,
Yeah, so I guess I'm answering my question a little bit in our cases, it was very clear that we were having complications before we got to the point where we would make that decision.
sure, so for those who don't know, Pitocin is the synthetic form of the hormone oxytocin, which is naturally made in the body for a lot of different things, like when you take certain drugs or when you have sex or when something's happy, you get a hug from a friend or when you're in birth. And it's called the bonding hormone oftentimes because it comes in large amounts right after you have your baby and it helps you bond with them and then it starts milk production. Pitocin doesn't have those nice side effects of the happy part, but it does have the part that contracts the uterus, because that's the other thing that oxytocin does. Pitocin contracts the uterus, but it does it at an unnatural level. It contracts the uterus so extreme that one of the main side effects of it is to have fetal heart distress because it
Oh, well,
squeezes the baby so hard. So a
that
lot of
that's
time
what happened.
people, you go to the hospital, they give you Pitocin, then they have to save the baby and you think you've been saved, but really it was the
Right.
Pitocin that caused the problem. And
Yeah.
that was what happened in my case in my first birth, at the hospital.
You had a stressful situation because of the
I
Pitocin?
had, Pitocin after 12 hours, my water broke, so they told me I had to go in if my water broke so I could get on antibiotics. That's a
Oh,
whole
I went
other
2
thing.
weeks without any of that. Yeah.
So they told me I had to because I had tested positive for group B strep, which is something that's naturally on the body and it's
Right.
not necessarily going to cause any problems. And where antibiotics, I believe, do now that I know more about what happened to my son and food allergies and everything else,
Oh,
right?
yeah. Mhm.
So I
Oh,
go to
because
the
it messes up
hospital.
your gut.
Yes, it takes away all of the good bacteria that you get when you pass through the birth canal that gets you started on the right
Yes.
foot. It's gone from mother and baby, and they have to recover from that afterwards. So I have the antibiotic drip and I'm doing everything I'm supposed to. And they keep telling me there's something wrong because the monitor says you're having strong contractions, but you're not feeling them. And I kept saying, no, I'm definitely feeling my contractions, but I've
Yeah.
been practicing to like stay calm because that's what you're supposed to do. You stay calm and you relax and you move around and the baby moves down and then you have a baby. Well, they weren't satisfied that with my progress after 12 hours at the hospital. My doctor I had had since I was a child, and she was delivering this baby just before she retired. She had delivered over 1,000 babies. I had complete trust in her, and I love her. I still do. She's a great person. But she went through it like, "Oh, we should just do a little bit of Pitocin." And that changed everything. Those contractions were like night and day. It
Y
went took me from 0 to 60 in seconds, and I was doubled over, and then before I know it, everybody's in the room,
Ouch.
even these guys in plain clothes talking about a golf tournament, and I'm like, "Who are those jerks?" And
Oh my gosh, talk
and
about your modesty is just
I know, and I do not
over.
like I'm not. Yes, no.
Holy cow.
So
Oh, I have such a funny story, I'll tell you in a minute. Okay, go ahead.
they tell me that the baby is in distress because they also have an electronic fetal heart rate monitor on my
Right.
body, which is reading the baby's heartbeat, which that's its own thing. Why are we doing that in the first
Yeah.
place? And it shows that there's a dip in the heart rate, so there's a problem with the baby. And I didn't know at the time it's because of the Pitocin that there's a drop in the heart rate. So then it's all of a sudden like really important to get the baby out. So
Yeah, I
then
had
what
no idea. It was so stressful because of that. It happened
and
over
then
and
what
over
do they
again.
do back, for, 100 years, it's been I literally just read an article on the Mayo Clinic where they call this a tradition instead of, like, a procedure. They give you an episiotomy, which is literally cutting your perineum, and they put an incision in there so that the baby can come out. It opens you only, like, a centimeter more, and it's super bad. It's your
Ruins
muscles
your
that
life, by the way.
can cause
It
incontinence, it can
just
cause all sorts of
don't wanna
problems, and
get gross, but that
healing from that is
yeah.
extremely challenging. There's stitches, and
I'm not sure it's
usually
really possible to fully heal from that.
the side effect from an episiotomy is that you tear at the site that they cut you. So wouldn't you just rather naturally tear if you're going
Yeah.
to?
Yeah.
That yes. So that was actually procedure for 100 years to do that to every first-time mother. So,
Wow.
yes. So every woman that went to the hospital, they were cut
Wow.
and
Ouch.
not often explained that that was gonna happen, and if you're not on any pain medication, that's just
Oh.
happening to you, and
Ugh.
that's what we had to go through. And then the baby comes out and he's totally fine, but they whisk him away
Yeah.
under lights and they put ointment in his eyes and
Yeah,
they're
they do that, yeah.
bathing him and all this stuff. And I go, "Do I need to deliver the placenta?" That's
Yeah,
the
yeah.
final. "Oh, no, we already got it out. It's gone." And I never saw it. I never saw blood. It was just everything was just busy and whipped
Yeah.
away from me. It was all the
Yeah.
humanity was just stripped away from it, right?
Yeah. And they say good
Yeah.
things about placenta. I don't know.
Yeah, I had a different experience with my second.
No, I mean, they say, yeah, like you can do stuff with it. Well,
Mhm, that's what I mean.
so I have to this is such a so Keelthor is saying ladies have been popping out babies for thousands of years without a hospital. People need to chill.
That's
And
just I mean, I that summarizes everything I'm saying here.
Stewart
Dude,
caught all 3 of his, and the 3rd one was do it yourself because the midwife didn't make it That's so awesome. I love
Yes, I
that.
love it. We've talked
And
a little bit about that before.
Kat points out we know so little about pregnancy and childbirth and the brain, the 2 things we know the least amount about.
Yeah.
So, so I have to say, like, let's see, get rid of that. Um, my story is that so this was a long time ago, and my husband, his mother was a doula.
Oh, yeah.
So, yeah, so she was pressuring me, like, to do things I did not wanna do. Like, I didn't wanna do a home birth. I didn't wanna, I don't know. It was and when Luke was born, uh, with Down syndrome, he could suck, but it's like it was very lengthy process. So she was, like, super pressuring about the nursing and everything, and it was
Mhm.
very stressful. But, so my husband was very comfortable in the delivery room, and it's like taking pictures and everything. So years later, there's technological revolution. We were having a party in our house, and he like hooks up the TV to the computer and starts just letting the photos make a slideshow of like 10,000 photos that we've
I
had in our
see where
life.
this
And I
is
was like,
going.
did you did you like screen those or whatever? Like, are it's just every picture like, and he's like, yeah, 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 don't worry about it. It's like, okay,
And
I'm
you're still
literally,
married.
oh my gosh. I'm across the room. I'm in the kitchen, like doing stuff, and there are people, whatever. And there's a huge TV across from which I don't even know how to use. Like, I don't know how to what he did. And there's birth pictures. It's like, yes, I'm still traumatized by
Oh
it.
my
I can't believe
gosh.
I told this story.
No,
But
that's
in
so
any case,
amazing.
yeah, so after the fact, I was aware of exactly what was going on. But yeah,
Uh,
I don't recommend breed. There's nobody needs pictures of that. Like, why would
that's what
anyone
I was
just don't
thinking.
you
Yeah,
just don't need pictures of that.
that's where I was at.
So yeah, so that was I was thinking that about the Pitocin, that may have been the problem. I know it was the problem with my mother and
Mhm,
me.
and uterine rupture is another side effect,
Absolutely.
especially if you've had a previous cesarean before, the
Yeah.
Pitocin.
Well,
Yeah,
a VBAC, I think, is out of favor, right? A
yeah,
vaginal birth
vaginal birth
after
after
a
cesarean
cesarean.
for people
Yeah.
who don't know. Yeah, they were on the upswing and encouraging them in the,
Yeah.
late '80s or in the early '90s, but they were discouraging them again, and that's interesting that the, cesarean rate in the United States is 32%. So 32% of babies born in the United States are born cesarean. Some of
2 out
those
of
are
3 of mine, they asked me to do cesarean at
and
one
some of
point
that
or
yeah, some of that's a planned cesarean, other is an emergency cesarean,
yeah.
but, I mean, what do they mean by emergency? They just say, "Oh, the
Yeah, it would
baby's
have been
too big or
this.
too small or whatever," and then they just need to take it, and it's more convenient for them, they make more money, it happens quicker, everything is more simple. But
Yeah.
a C-section, for those who don't know, is cutting your abdomen open and removing the baby from the womb, that's cutting through 6 layers of tissue. It is the 2nd most common major surgery in the United States. Number 1 is cataract surgery. Number 4 is,
Wow.
circumcision. Number 2 is the cesarean section. So,
Wow.
yes, and it has a different feeling, if you have a visible wound, people are like, "Let's take care of you, you need to rest." But if you've had a baby, that's just a normal thing, right? So you're encouraged to get back on your feet sooner, I think, and people have a hard time healing from that.
Also, it limits the amount of children you can have, which is important for some of the people in my Catholic community. Like, you
Mhm.
really are supposed to have 4 kids. You just can't your body, it can't take stretching and closing up
Oh,
again that
sure.
often.
That's when there's a increases risk, yeah.
And, from what I understand, the baby goes through a kind of purging process when it slithers through the birth
Absolutely.
canal.
Yes. So I
Do you
was
not want to
not
see
born. I
the
was ripped from my mother's
Oh,
womb.
like Caesar
Uh-huh,
and
and
Macbeth.
so was Chud, my husband, so we both
Nice.
had really big feelings about that, but when the baby moves through the birth canal, they're squeezed, and so I don't for people who don't know, babies are practicing breathing in the amniotic fluid, so they're actually taking the amniotic fluid into their lungs during the little later part of their gestation. As they move through the birth canal, they're squeezed, and that expels that fluid so they can take their first breath when they come out and not have a mouthful, lungful of fluid.
Yeah,
When you're removed in another way, they have to vacuum suck your mouth,
yeah.
and that leaves a lot of fluid in there, and I did. I had, pneumonia at, just a
Oh,
month old, and I had
poor
asthma
thing.
and allergies, and
Oh my
you're
gosh.
also able to give the mother has to be on antibiotics during that process, so you're also doing that. You're not getting any of the microbiome from passing through the birth canal. It's just you're circumventing this whole huge part of the process to bring that person into the world. If you look at it from a bigger picture, it's like they're doing it on purpose
Yeah,
to
the
like
Pitocin
yeah.
thing, that's really because that's when they wanted to give me the C-section, and then the second the second child I had, my daughter, I went in the morning, my doctor was out of town, so I had his substitute. She didn't want anything to do with it. I said, like, "I'm definitely in labor." She's like, "No, you're not." So then 11 o'clock at night, 12 hours later, I went to the hospital. I was like, "I'm definitely in labor." She's like, "No, you're not." And she would not get out of bed, whatever. And I said, I so the baby just started coming out, and so I did not get the epidural, and
Mm.
boy, did that hurt. Holy cow. And really, really hurt. But one thing about my daughter, and this runs in my family, big shoulders, her collarbone broke on the way out, and they
Mm.
didn't even notice it. So I took, for weeks, I had this poor baby who was in obvious pain.
Were they trying to remove her in any way? Was their hands trying to remove her?
I don't know. My good doctor, the first one, said that when there are shoulders like that, if you have problems, because one of my cousins, that it didn't break, and the kid's arm was totally paralyzed and had to be amputated later in life because
Mm.
the problem is not breaking. It's supposed to break. It's very soft if you have a problem like that. So he said if it were him, he would have broken it on purpose. He would
So
reach
there's
up in there and break it on purpose.
shoulder dystocia is what it's called when a shoulder gets stuck in the pelvis, and that's not uncommon. Midwives are trained in different ways to manipulate the baby carefully to get them out, and then other doctors are trained to break their clavicle or
Yeah.
to remove them with forceps or to cut you and then use a vacuum.
Ow.
So either and then the vacuum, yeah, before I was born, they tried to vacuum me. So my
Oh
mom has a
yeah.
cute story about me having a cone head when
Yeah,
they finally
absolutely.
pulled
And
me
a
out.
bruise sometimes. But yeah,
Mhm.
the cone head. Yeah, I've
So
seen that.
all of those interventions where they're doing things manually to try to remove the baby also have side effects. So sometimes what happens is we have to take these stories in, and it's so touchy to talk to other women about their story because
And it can
afterwards
get
you
kind of gross, so sorry, I didn't it
sure.
was
Yeah, we should have had a
really get
disclaimer.
gross. I think
But
the title was enough.
right, you know what you're getting into. But you come into this I'm gonna have a baby. You come out of it with all these things that happen to you, some of which you were aware of, some of which you current kind of weren't aware of, and you start to understand later. And it's like it takes this. You have to frame that story in a way that you can move on from it. And it's really touchy to try to talk to another woman about it and say, "Hey, did that really happen, or did they cause it and then save you?" And they don't. People don't want to hear that. Just like if you're talking about people that went to the hospital in 2020 and were overtreated for some disease that may or may not exist, and they didn't make it out of the hospital. People I know that were put
Oh,
on
yeah.
ventilators unnecessarily, and they didn't make it out of the hospital. Their families don't want to think that somebody did that to them,
I
and so it's
know.
very similar into this, like, we have to trust the system and we have to frame this in a way where we can heal from it. But it's like somewhere in there, you've been abused and things happened to you that you didn't agree to and that you didn't understand. And then they said they saved you.
My mother would not go to the hospital if her life depended on it. That's funny enough, but she had the worst food poisoning a couple of years before she died. For it lasted for months. I mean, her body just could not, well, it did, but it just took forever. And everybody was trying to pressure her to go to the hospital, and somebody called me who was on the scene, I was out of town, and said, "Look, you know, mommy won't go to the hospital." And I said, "So she'll die at home." And
Yeah.
they're like,
I
"What
know.
what the hell are you
Wouldn't that
talking
be a
about?"
better way to go if
She's
you had to?
93, she wants to die at home, let her die. She's gonna die if you take her to the hospital. That's
Right.
what
And
she
then,
said, "I'll never come home," and there's no doubt in my mind she never would have come home. She's like, "Don't take me to the hospital because 'cause I'm never coming home."
no.
It's like, "Right." She's like,
And
"I'll
she's
just
right.
die." Right,
Yep.
and then there's so many people I know, and I thought of all the people in my family, young or old, who died. I could trace a lot of it to my father died of a surgery he didn't need and that
Hmm.
he couldn't handle. I think that the other deaths were, pharma related
Yeah.
problems,
Hmm.
and it's just, yeah, I think you're onto something where that's what people said to me about COVID. I'll say anytime someone tells me their relative died of COVID, I'll say, "Were they in a hospital? Were they on a ventilator? Did they get
Yeah.
remdesivir?"
Right.
And every answer is always, "Yes, but." She was
Mhm.
on the verge of death. I'm like,
Right.
"Well, she sure was."
Yeah.
You know?
Yeah.
She was
Right.
when she walked through those doors, and yeah, I mean, maybe, but same thing with the AIDS and the AZT. They
Mhm.
always are getting it.
Yeah.
There's always like, or they're I look, let's just say, cherchez la, you know, doctor.
Yeah. So we've talked a lot more about medical birth than home birth, but it's like I feel like to understand why someone would want a home birth in this day and age, you have to understand why you wouldn't want to go to the hospital. And then we
Yes.
can step back and think like how, yes, we've been having babies naturally for thousands, millions of since the beginning of time.
So I just want to close up this my second, and then
Please.
we'll move on, which is this. So it was horrible agony. I screamed
Mm-hmm.
like crazy for an hour, just screamed. I made a note to myself. I'm like, don't romanticize this. The next time you have a baby, like you get that epidural, like don't let anybody talk you out of it. And when I came out of the room, like everybody clapped, like all the nurses, because I had been screaming at the top of my
It's like, oh, finally she's
lungs.
quiet. We'll clap for
Right, they
that.
were just like, "Great job." I'm like, "Yes, I shut up, thank you." But I will tell you this, the baby and I were we were recovered immediately. Like, I was couldn't have felt better. I realize now, like, the reason you need a couple of days to rest is, like, those drugs really give you a hangover,
It
and the
was such a
baby
big
too.
difference. Yes.
Such
Okay.
a big difference.
And we've talked a lot about an epidural, but for people who don't know, the epidural is referring to the way they administer a medication. It's not the medication. So an epidural is usually a catheter inserted to the fluid inside the spinal column to make you numb from the waist down. And it's sometimes accompanied by a spinal block, with other people might be familiar with. And these are narcotic pain medicines being put into your spine. So side effects from that can be spinal fluid leaking out into the body or nerve damage in that area. Other kind of problems like that from actually inserting something into your spinal
They used
column.
to be very dangerous. They're
Right,
less
and they
dangerous now, but they
supposedly are better at it than they used to be because they've practiced on so
yeah.
many people, but they leave a little tube in there so they can give you more medicine as needed, and they're usually for birth and not surgery, they're trying to give you a walking epidural, which means that you still have some use of your legs, but you can't
Mhm.
feel it, so that you can move around. But the biggest side effect of an epidural is that it leads to other interventions like Pitocin and a cesarean because you do lose some feeling of your lower half, and that part that's connecting you is what's trying to make the baby come out.
That's
So
what
that's
where we connected on this, because there was this study that said, "Oh, don't believe any of that. Epidurals reduce maternal mortality or something." But it was such a sketchy article. You could not validate it. I went back, I read the study. They did not give the information that broke out the adjustments they made to come to these conclusions. There was no way to know if the demographics pertain to you personally, because the demographics would have different indications for different
yeah, there
subgroups.
was something like 20 different problems that the
Yeah.
people had that and then it made it better.
Yeah.
So there's a Dr. Sarah Wickham, I believe. I've read some of her books. She's out of the UK and she usually breaks down studies like these. So I looked on her blog and did find that she was speaking on this recently. The UK study was the people in the study had 22% of them had epidurals, which I think is interesting too because the US epidural rate is 70 to
Yeah, I
75%,
saw that, yeah, uh-huh.
right? So then that without the epidurals in this UK study, 1 in 235 had severe maternal morbidity, not mortality. So it didn't mean they died. It means that they have something that could cause
Oh,
them to die, which is also tricky because it's
oh,
they
I missed that.
morbidity, not mortality, right? So 1 in 590 were hospitalized. And then with the epidural, 1 in 237 had
That's
severe.
not a
So that's the difference
statistically
of 2
discernible,
people.
but not
1 of
even,
yeah,
because, it's
yeah,
just too small a number.
right. 1 in 235 without, and with the epidural, 1 in 237. That's not you can't that's not even
No,
something worth talking about, right?
right.
And that means 1 in a 706 went to the hospital. So there were fewer people went to the hospital for severe complications within 6 weeks after delivering their baby when they had the epidural. And it's like, that's so minute. That is like, that's what we need to break these studies down to see it's so
Total.
small. And that's for 500,000 people. That was over 500,000 people in the study.
And that's just too small a number for me to be able to say that's causal.
Mhm. And
Like, there
you
could be other
can't even test for
variables, like
that.
Yeah, you can't because plus, like, tiny little variables can make tiny little difference. I don't think it's statistic that doesn't even sound statistically significant to me, but I
It's
would
not.
just say that if the decision-making process to get an epidural goes hand in hand with some other decisions that had a good outcome, that would be enough to wipe that
Right.
causation right out. So,
It's interesting too
that's why
because
you wanna see the adjustments.
the UK still has midwives as their first line of contact for pregnant women. So you have a midwife
So I
that you
might
see
be
through your
right
pregnancy,
that
and
they
so that's
were
why they have a
accurate.
lower
Yeah.
epidural rate there. But those midwives
Interesting.
are what we're moving towards to in the home birth community to start calling medwives because they're so much a part of the medical system. They still work for the hospital. They still follow some of the same rules, but they have this foundation of understanding physiological birth so that they can support that through people. But they can still, you're still ending up in the hospital where you have access to all the medicine side of things. So,
Interesting, and
yeah.
so that would support my theory that there's a chance that that article was designed to discourage home births, even though it never mentions home births, because this is a national health system in the UK,
Mhm.
so if they make the decision that epidurals are recommended for a group of people perforce,
Yes.
that means that hospital births are recommended for
Well, and if
those
they're
people.
looking at their epidural rate's only 22% and we're doing 70 to 75, they're like, "We could make this is a great untapped market.
Right,
We could be doing a
definitely.
lot more epidurals in the UK if people thought it was going to actually help
And
something besides just the pain."
the sinister way that medicine works, and we know it from the Vanderbilt lady who said, "If we make kids trans if we give them trans surgery, they'll be patients for life."
Customers for
They
life.
know, yeah,
Yes,
that one thing leads to more medical, like,
absolutely.
I wouldn't be surprised if the next step of that or the flip side of that study is what is the more profitable route for us? But it's a little weird with public health. Like, it's sometimes they do actually cut corners for the money. Like, it's hard
Mhm.
to know, but I'm
Mhm.
sure that's changing.
Yeah, it's so interesting. And, one thing to know is I wish I would have written down our induction rate in the United States. To be induced or to have an induction is you're pregnant and you don't go into labor spontaneously. The doctors tell you there's some reason that they need to get this moving. So they initiate a series of things to get your labor started, and they're usually mm, commonly it's because you've gone over what they think is the appropriate gestation, which is 40 to 42 weeks. 40 weeks is full term, 42 weeks is usually the cutoff where they say you can't go any longer. But how many people just messed up the date in the first place, right? There's all these other factors. If the baby's not sending out the hormones that make your body react to it to initiate labor, it's not ready to be born yet. And so we're trying to take babies
Right.
that are early and they have complications like breathing complications because the lungs are the last thing to develop in a fetus. And then induction itself has so many complications. So starting with an induction really commonly leads to a C-section because you can't get the baby out and it's days and it's painful and you're exhausted and they won't let you eat.
And the Pitocin, which they use in inductions, cause the lower heart rate that leads to demand for C-section. That's exactly what happened
Absolutely.
to me.
Not only that, but it's can cause postpartum hemorrhage, and it can cause the uterine rupture. So there's danger to the mother, and it kind of seems like the medicine has looked to the mother as secondary during labor, and the fetus, the baby, as number one when you're in that situation. So they will sacrifice your health and well being to get that baby out safely. And I think that part of that is their insurance too, the liability of if you lose that baby, it's a big deal. But the mom can is more likely to be able to recover and say, "Oh, at least I have a healthy baby." Pitocin
Or
is not the only thing that they use to induce. They also have a Foley bulb catheter, which is a catheter they insert into the uterus and then start to open like a balloon.
ow.
So it's like literally prying a rosebud open and saying, "Now it's
Mm.
bloomed," right? It's
Oh,
not. You're just prying that open. They manually break waters certain times, which we know is an increase for infection, especially when you're putting somebody's hand, even a gloved hand, in a sterile environment
yeah.
is a more possibility for infection. There's other kinds of drugs that they use to start besides pitocin, including Cytotec, which you might know is the abortion pill. So Yes, because that starts uterine contractions. So it's like you're
Oh my
basically aborting your
god.
full-term fetus and just hoping it
Hoping
lives.
for the best.
Yes,
Ouch.
the side effects also of that are uterine rupture, infection, increased chance of C-section, and the uterine rupture on that one too is like, I think if you've had a previous C-section, they
Yeah.
won't use Cytotec to
Wow,
induce
because
your
it's
labor
that
because
big.
it's that big,
I
yeah.
One thing we did, that doctor I liked, which like nobody does this, so I don't know if there is something wrong with it, but you can, without breaking the water, you can just
So a
separate it.
membrane sweep.
Yeah,
Yes, a membrane sweep
that's
is to
very effective.
separate the the water bag from the
R
uterus so that it
Right.
and that'll stimulate these prolastins, I
Yeah,
think
it
they're
definitely
called,
works for me, I
which
think, every
start
single time.
contractions, and
Mhm.
I also had that from my first one, and I think that's why my labor was longer
Yeah,
initially. It's because it wasn't ready, and they were like, "Oh,
right.
you're 40 weeks." Well, it's my first kid. Most people go over 40 weeks with their first kid.
Oh, I was like, "Somebody's here to watch my other kids, so
Yeah,
just do
go ahead,
that."
let's
It's like,
do
"Okay."
this. Yeah, so they did that, and it's not comfortable, it's painful, and side effects for that are infection or accidentally breaking the water when you don't I mean to,
Not ready yet.
and
Mhm.
all those other things, yes. And so you try to manually start things early, it's gonna lead to a longer labor, and if you're in the hospital, they're gonna tell you, "Now you're going too long, so it's not safe anymore, we need to move
Right.
you to this next phase of intervention," which eventually ends up with a C-section or a forceps or a vacuum extraction. And then none of those things are good for you or the baby.
Interesting. So I see where you're going with this. Like, we think that my first reaction is that the home birth is the riskier one,
Absolutely. And when you start
but
to look at the actual
that's not
data, the
always true.
facts, the research, it's not the case. The unfortunate part is there isn't a lot of good statistics on home births because it's not collected the same way as it is in a hospital. But when you know what we know about the studies that come out anyway, who cares? Like, let's just let's look at
Yeah,
the
no,
people
you have
we
to evaluate your own stuff.
yeah.
Yeah, you can't. You
Mhm.
have to do your own research and you have to use your head. Like, I can't, you can't trust their recommendations.
Yes, and so a lot of the things they do in the hospital starts the interventions, just even from ultrasounds to being incorrect or making them worry, or even the continuous fetal heart rate monitor, which we didn't start using until the 70s. We had Doppler technology before that, where we could check a fetal heart rate or also use a stethoscope. That's been around since the 1700s. But the continuous fetal heart rate monitor first started where they would literally put an electrode up and attach a nail to the baby's scalp to manage hearing their heartbeat. But there was never any studies done to monitor what a baseline heartbeat was normal for a baby during childbirth. So all they did is then say, okay, it's usually about here, 140 beats per minute. If it dips lower than that, then they're in distress. Well, of course, if you're getting squeezed when you're moving through the birth canal, it dips somewhat, right? Then they say you're in distress. They cut you or they have use a vacuum extraction. So they never actually developed the science that would say there was any. Yes, you can hear the heartbeat, but what does it mean? They still never have proven that. So in the 70s, there was only, I think, 25% of people were using the continuous fetal heart rate monitor. Now it's like you can't be in the hospital unless they have that on you. And then they're using that to determine if the baby is well or not.
Right. Typical overdiagnosis
Mhm.
risk of,
Yeah.
yeah, over
Yes. And
testing.
so a hospital and a home birth isn't the only option. And when I say home birth, I literally mean birthing at home. Most people think of that as with a midwife, but it doesn't have to be.
Ask
There's a
Stewart.
whole community of people that are doing free births, which is that there's no trained person there. There's other people doing sovereign births, which are midwives that aren't licensed by the state. So they're not answering to anybody but the birthing woman. And they're able to come in there with their knowledge and expertise of being with other labors and pregnancies, and births to be able to help women. There's birth keepers are the name they use those oftentimes. And then there's the medical midwife, which you can choose as well. So there's a lot of different things to look into if you're going to approach pregnancy, and you start looking into it early. You can kind of figure out where you feel comfortable. And for me, the first time that I stepped out of the hospital for my pregnancy in 2020, it was having a midwife that had training. But more importantly than that was that they had experience. And the one I chose had delivered over 1,000 babies. And I was like, yeah, you've been around to see a lot. And she didn't just deliver 1,000 babies. she witnessed 1,000 physiological births, whereas my first doctor had been at 1,000 deliveries, but she's been at 1,000 deliveries that ended in C-section, that had Pitocin, that had all these intervention,
Right.
and she sees it that she saved those people and those babies,
Right.
where this other woman witnessed the women in their power doing what women do, and she went in with the confidence to see, I know you can do this and your body can do it.
So, did you happen to discuss with that midwife any complications she'd experienced and how you can plan ahead?
So when you're interviewing a midwife, you can ask them what their stats are, like how many of your home births transfer to a hospital. Have you ever lost a baby or a mother? Have you ever had a postpartum hemorrhage, and how did you deal with that? So yeah, we went through all of those kind of questions, and like the what ifs of the worry that I had at that time. And now knowing more, I don't have those same worries if I was to do this again.
Well, what was some of her answers? What she must have had a hairy experience here or there. What
Yeah,
was the hairy
there's been
experience?
women that transferred. Oftentimes they transfer, she would said, when it's their first pregnancy and they just get too tired to keep going. And then I
Oh, interesting.
Yeah, because first pregnancies are longer and your
Right.
body doesn't really know what to do. You or even if you've had a baby, but you've had a long wait, like, more than
Mhm.
10 years, your body kind of has to start over knowing what to do. I think the biggest problem with the way we look at childbirth is this idea that we have to make something happen. When you actually have you ever heard that like a woman in a coma has delivered a baby like
Mhm.
overnight? The guards, the nurses come to check on her
Mhm.
again. There's a baby
There's a
laying there
baby in there? Ooh.
and you're in a coma. It's because your body does everything
Right.
absolutely just as
Yeah.
if have a stomach ache and you're sick and you need to
Yeah.
purge, you throw up. That's not something you have
Yeah.
to think about. You don't have to push. No one's yelling push
When I
to you when
had
you're
my baby accidentally, naturally in the hospital, I was like, "Oh, I didn't go to any of those classes. I have no idea what to do." And the lady was like, "Don't worry about
just yes.
it. You
So
couldn't stop it if you wanted to."
there is something that most people don't know of called the fetal ejection reflex, and
Mm.
that happens when the baby is fully engaged in the birth canal and lined up just right. Your body pushes. It's like throwing up upside down.
Yeah.
That's what I how I
Yes.
described it
Oh,
after my
yeah, there was
last
nothing
one.
I could do about it, yeah.
It just happens.
She
Your
was
body
coming
pushes
out.
involuntarily. You
I
don't
didn't
have
want her
to.
to come out.
So, well,
I
then,
wanted to wait for the doctor,
right?
but she came out
But
anyway.
in a hospital, they say, "Okay, I can see the head, so you should start pushing," and they tell you to push, and they tell you to push. In the home birth community, often it's called purple pushing because your face will turn purple. People break blood vessels in their eyes. They tell you to lay on your back and put your chin to your chest and push as hard as you can,
Yeah.
and that doesn't actually bring the baby out any quicker. That
Right.
doesn't do any favors for the mom, and that helps you, run out of your energy way faster than
Ah,
just
yeah, uh-huh.
walking around or sitting on a birth stool or, there's all these different positions you can be in. It's not just on your back with your feet in stirrups and people yelling at you.
So, yes, that I always thought that was crazy, that I mean, obviously, those incredibly painful, violent contractions are you're not doing that on purpose, like,
The
that's just
painful and violent contractions were the Pitocin, and I have to say,
no,
then
even
doing it
the
by
natural
myself.
one
But I think there's so much to be said about the mindset that if you set out to that to know that you were gonna go through that, that would have felt different to
would have been
you
better,
than
yeah, okay.
not wanting that. That was like not a consensual experience for
That
you
was not a
because
consensual experience,
'cause you were
absolutely
ready to
not.
have an epidural and you had a
Yeah.
thought in your mind and it didn't work out for you, and that's totally sucks. But when you walk into it
No,
knowing
it
what
was
you're getting
okay, yeah.
into,
It was worth it,
and
yeah.
it's kinda gradual, it doesn't just, oh, it's not all at once, it's not really sudden usually, and there's these breaks in between contractions up until the very end where it gets pretty intense. But then all of these endorphins, these hormones that your body gives you afterwards, you're just flooded with, like, the most
Yeah, that
euphoric
was good.
feeling,
Yeah,
and
I'm
that
with you there.
baby's there, and their smell, and then you're nursing, and
Yeah.
it's just like, oh, it's amazing.
That's why I had to make a mental note, like, don't oh, he's Stuart's actually making bacon. I thought he was I thought he was frying it
He
up
was
in
like, "Is
a
this like a
pan.
sexual innuendo?" Like, I didn't
He's
understand.
no,
No,
he's literally making bacon, but he's not
that's
cooking
great.
bacon.
No,
He's
he's
making it.
curing
Yeah,
bacon. I
that's
love it. I've
perfect.
done it
That's
before too. I
fantastic.
I need to
Yeah,
practice because it didn't turn
that's
out great.
great.
But okay,
Yeah.
yeah, so for my home birth, I picked the midwife, but I decided I didn't wanna call them during my early phase of labor because I didn't want anybody to be bothering me. So labor is slow. I knew I was in labor at 7 AM, and I cleaned the house and I built Legos with my 6-year-old, who was 6 at the time. I Chud needed to mow our pasture, so he was out on the tractor, but he had his cell phone up as loud as it goes and his flip phone in his pocket. So if I needed anything, I did the dishes. Cleaned the house better than ever. I was
What about
cleaning
your older
things.
son?
Yeah, well, we played Legos. I made him breakfast. I made him lunch, and then my mom stopped by, and I was like, do you want to be here because I think this is happening tonight, or do you want to go? And he's like, I'm going to grandma's because grandma's house has like crappy
Y
food and like
yeah,
TV all
yeah,
night. So he
yeah.
went. And then it was just us, and I made dinner. I cleaned up after dinner, and then it really started ramping up after that. We did let the midwife know that it was kind of coming, but it was not about until I think 9:30. I said, Chud, you should call her because I think it's getting close. And then about a half an hour after that, she was already on her way. Call her back and let her know I can feel the head. So I was still by myself,
Wow.
and
And
I
you
was
weren't
having
worried?
the fetal not at all. No, the fetal ejection reflex, everything was going totally as I expected. I could still feel the baby moving, so I know they're alive.
Right.
It's just we're just going through this. She gets there and then comes and finds me, and then TMI asks me, "Do you want to have the baby on the toilet, or do you think you should maybe
Yeah.
move? Because where do you feel comfortable if you're
Yeah,
like, my
right.
stomach hurts, you just go sit on the toilet."
Yeah, ouch.
And I was like, "No, okay." So then I moved to not have a toilet baby, and I
Good, that's good.
got on the
So
bed, and 15 minutes after she arrived, my son was born. Chud caught him into his arms, placed him on my chest, and he started to cry. She didn't touch him. She didn't touch me. All she did was clean up the area, and then her
was the
assistant came.
string still attached?
Umbilical cord still attached, and then we waited until the umbilical cord, like I had delivered the placenta within the hour. I'm not sure how long it was. Breastfeeding, and then the cord, it gets flat and white. And I wanted to speak to you being concerned about it being around the neck. It's actually really common for it to be around a baby's neck, and it's
Yeah, I
not
know.
a concern. There's something they call Wharton's jelly with a WH, Wharton, like a doctor's last name who discovered it, that
Yeah.
coats this umbilical cord and makes it so that it can't constrict. So even if the baby is being
Oh,
strangled, it's still getting blood oxygen from your blood through the placenta.
wow.
So it doesn't cause any problems. It can
Right,
just make
doesn't
it kind of
actually need
tricky
to
to get them out
breathe.
and
Yeah,
untangle them.
right.
So
Interesting.
yeah, so he my son was healthy and pink, and me not even realizing that the midwife is checking him visually for all the signs, like they do that APGAR test, right?
Yeah,
To see their color and their that they're moving and that they sneeze to start to clear the
yeah,
fluid out and all of that. And it's wonderful. And then the placenta's out, and then the cord is then turns like from what looks like an umbilical cord, it's pulsing and there's a veins in it, to this flat, dead thing. And that's when we say we're going to cut the cord, and we do.
wow.
The placenta has been drained of its color and the baby is pink. And that's the biggest difference, right? The
Wow.
blood from the placenta enters the baby. They get to start life with their full blood volume, and unlike in the hospital when they cut it immediately, and they are
I had
pale and
no
weak,
idea.
right? So
They're always, like, yellow and,
yeah,
they
right?
get
Weird
they
colors are
get that
purple.
jaundice right away, yeah.
Yes, so this healthy pink
Which
color,
I'm
and
guessing is in part jaundice could be related to having lower blood volume, just not
it
having enough
could be
iron
that.
because
And
it's not
then
there.
he was a little yellow in the days after, which
Mhm.
I can't remember what causes that, but it's not
It's
really a
that
concern.
bilirubin thing? Yeah,
Yes.
yeah, yeah,
Mhm.
yeah.
So you just
So
need to nursing a lot helps. Fluids
right,
help, and then sunlight helps as well. So that
nice.
was just stood by the window sometimes,
Was he
and
blonde already?
he was bald. It's just like a fuzzy blonde. Yes, that was it.
Cute.
And both my kids were bald for like a really long time. So it was like perfect. And then they tell you how to make your bed. Like all these little things you don't think about. They say, make your bed with fitted sheet and that you want to sleep on. And then put a shower curtain, like go buy a brand new shower curtain, put it over that, and then put another fitted sheet that you don't care about, like that could get thrown
Mhm,
away if
mhm.
it's ruined. So the first time you get up to use the bathroom, the midwives strip the sheets, they start laundry, they take your trash out, they clean up the space, they finish filling out the paperwork, and you're just laying there with your partner and your baby, and they cover you. Someone put socks on me, like it was like, do you need any food? And then it was like, we're good. Okay, well, good night. So
Wow.
he was born at 11:15. They left at 1 o'clock in the morning. We went to
Do they
sleep.
sign the birth certificate? Is that
They
something
help
that
fill out the
you
paperwork, it
do?
doesn't
Mhm.
get sent in right away, but you they leave it with you so you can finish filling it out and
Or
then
throw it away if you want?
yeah, right? Depending on where you're at with that.
As my
Uh,
father was so adamant against me ever, like, getting a Social Security card, getting a marriage license, any of that stuff, and,
yeah,
I
it's
don't
tricky, it's hard to make
I
those
couldn't live
decisions.
yeah, I couldn't live
Yeah.
like that, but
Yeah. So it was a really beautiful experience at home, and the recovery from that birth was absolutely shocking, like how night and day different it was. How good I felt mentally and physically, and how easy it was to bond with the baby and to start nursing. And that was to me is like that's because I was allowed to go through all of that. It's like women are set up for this portal to bring them through and prepare them for what they're going to do. Like motherhood's a big deal. And to take that, like, I feel like the system is robbing women of that experience that would bring them into being a really strong mother. The kind of mother who wouldn't let their kid just go to school and wear a mask, the kind of mother who wouldn't,
Yes.
just not think about what kind of food they were putting in their kid or what they were shooting into their kid. Like it's just night and day different.
What in your research, talking to your midwife, everything, are the actual biggest risks of a home birth? What did she experience to prepare for? Um, how do you
So,
what
they're
are the
always
issues
worried
and how do you plan
yeah,
ahead?
postpartum hemorrhage, so bleeding too much after birth. Midwives also carry Pitocin. Pitocin is recommended by the medical board to give to every woman after birth because it
Really?
helps contract the uterus, which helps that wound close from where the
Did you
placenta
get that?
detaches, and that's the one thing that wasn't perfect about my last one. She said, "You're bleeding a little more than you like, so I'm gonna give you a shot," and she did that,
How
and
did it feel?
I didn't like it. It was,
Right.
uncomfortable. I had a really strong contractions, but I'm holding the baby and I'm feeling good. But I
Yeah.
kept thinking, like, I'm a big person and I
Yeah.
have a lot of blood. I felt
y-
great. My
Yeah.
color was great. I got up. My blood pressure was great. I didn't need that. And so if I was going into this again, I would be very vocal with my midwife. I do not want that
Right.
unless we have all
Yeah.
these
Let's
where
keep
I say,
going.
I
Yeah.
don't feel good. I need help, you know?
Right. Yeah.
Yeah.
Right.
So that postpartum hemorrhage is one. And then,
And
really
that
it's
seizure
just
thing,
the seizure thing,
eclampsia.
the eclampsia is rare, but it can happen, and it's not going to not happen if you're in the hospital. So,
Right.
it's
But what do
nothing
you do?
nothing's better, and it's just it hurts and it's uncomfortable, but they're trained to make sure they're holding you down and making sure you're getting oxygen and you're not hurting yourself in the act of the seizure, and then you're transporting to the hospital.
So
So,
that seizure is not deadly? It's
not that I know
unlikely
of.
to be fatal?
Yeah, not that I know of.
Unlikely to be
And I
fatal.
probably should have led with this, but I'm not a doctor, and this is not medical advice.
Right, or definitely oh my gosh, yes, whatever. We're just having a conversation about our
Absolutely.
experiences.
Mhm. So, yeah, I think that, the thing that you're not gonna get most of the time at home is the intervention that's gonna cause complications. However, there are certain midwives that or midwives that are going to say, "Hey, take these herbs because 'cause you're getting too close." Like, "I don't feel comfortable delivering your baby at home if you're after 40 something weeks because they might be too big, and then it's a risk of shoulder dystocia." So they're telling you to take herbs or drink castor oil or other things that cause total, it starts contractions because 'cause you're having, like, violent diarrhea. It's, like, not
Yeah,
the way you wanna
castor
get
oil.
started.
That's
Yeah,
like
it's
that, curcumin. I get a tincture of curcumin.
mhm.
Somebody listens sends it, and it's unbelievably powerful. I had absolutely no idea. It's like, "Take 10 drops." Holy cow. I was like,
I've
doubled
heard,
over in
like
pain
yeah,
for
I've heard.
2 days.
Whoa. So
So,
it's
yeah.
kind of yeah, it's these things that they say to, naturally induce, or I could do a membrane sweep, or I could break your water. Midwives are doing those interventions. So if that's important to you to not have that, it's important when you're first interviewing your midwife to make sure you're speaking that. And it's sometimes tricky depending on where you live, and there's different laws about, home births in different states, but there is absolutely no laws about having your baby at home without an attendant. So it's
I
not illegal to have your baby at home without a midwife there. And, it doesn't mean that somebody's not gonna call CPS on you and you're not gonna get, hassled, but it does mean there's no law on that. I mean, how could there be? If you go into spontaneous labor, you
Yeah,
don't
yeah,
get
right.
to
I
the
mean, it
hospital on time,
happens.
you're delivering in the car or a elevator, wherever, or at your house, it just happens. So,
And if there is something wrong, like, how far are you from the hospital. Is there a circumstance under which I mean, are you taking any chances? Like, when you were in that situation, were you thinking, "I'm not going to the hospital under any circumstances," or were you gonna trust the midwife on that? Like, if you did feel like there was something
The midwife
complicated.
asked me a question. She said, "If you start to tell me you wanna go to the hospital, but I see that there's no medical reason for you to go, do you want me to let you go, or do you want me to encourage you to stay?" And I was
Wow.
like, "That's a great question to ask first, because I bet some people in their weakness that aren't feeling well, they're going to scream, 'Please, oh, I need to go to the hospital, I need
Yes,
drugs,' right?" And
yes,
she's like, "Do you
yes.
want me to stop you from that, or do you want me to, like, give in to that?" And
Wow.
I was like, "Well, I'm not gonna say that." And I
Wow,
didn't,
yeah,
because I know that's scarier to me than being at home and not feeling well.
right.
So I said, "I don't wanna go to the hospital," and it's, like, only in an extreme if I lose consciousness and you cannot wake me up, yes, I don't wanna die and leave
Right,
my husband with a newborn baby.
right,
I don't want my child to die, obviously.
right.
So, but those circumstances when that happens are so far and few between, and they're so like, especially in physiological birth, because most of the big complications that happen during birth are because of the intervention that they're giving you. So
And
avoiding
what about
those, you
well, I
have a
have to
better
say the
choice.
2 people I know who died in childbirth were in the hospital. Except for my grandmother, her mother died in childbirth. I think they were on a ship from she was traveling from, like, her mother was emigrating from
Oh,
Syria to
wow.
New York and died in childbirth. I really don't know the details of it, but then my grandmother gave birth to my father at home, so,
Mhm.
it wasn't
Yeah.
no,
And
it's
so, it was important for us to be here for that second birth because we had moved to the homestead the year before, and so I was birthing another boy in the house that had birthed my husband's great-grandpa. And
nice.
those siblings, right? So it was like his and no, his grandpa and, his brother were born in this house. His dad was not, and his sister, they had put a hospital that were just out at the end of the road. So they went to the hospital in the '50s to have those kids. But they were born with a Native American midwife. The grandparents were in this house. So it was like
Wow.
it just was super cool, like this history of it, and they were okay. But when we look back at maternal mortality in history, it's
Yeah.
often correlated to hygiene and
Yes.
nutrition. So you're
Yes.
malnourished, you don't have the nutrient stores that you need to go through this big change, and you also hygiene. So just basic hand washing, not
Yeah, this was
antibiotics,
on
but
a
soap
ship,
and
I
water,
can't imagine. Yeah.
and how hungry were they before they, for the years before to not have the stores that
Yeah.
they needed, or how
Mhm.
close together were their pregnancies. So
Mhm.
because that's really depleting. You use a lot of your nutrient stores during that
Mhm.
pregnancy and then to have another one soon after. So yeah, there's like we just have a better chance for a good outcome if we let nature do its thing, just because of the little bit we know about, washing our hands and good nutrients and all of those things, then instead of taking it to the hospital. And we really know, it was a psyop. That was Rockefeller medicine that told us we need to start going to the hospital. And
Yeah.
initially it was for rich people. It was saying, let's go have a spa-like experience. And I don't know if
Mhm.
you've ever heard of twilight sleep.
My mother, all of her kids, every she wasn't awake for any of them,
Right. And so
and she got to
that's
stay in the hospital for 5 days. Of course, she was going to the hospital. She
when
had
we talk
9
about
kids.
food, okay, so when we talk about food and we think, how many generations we are about from growing and preparing our own food, birth is even longer than that. Like we've been having our births in the United States controlled by medicine for over 100 years.
Mm.
And thinking about that, every in the just in the '50s, every woman was
Yeah.
x-rayed before that they gave birth to make sure
Ouch.
the baby
Well,
wasn't
that would
too big.
explain a lot.
Is that good for
My
the baby?
family
Now
is
they say they
super
won't even do
strict.
dental x-rays because when you're pregnant, because it's you don't wanna be exposed to that, right? Well, it's the
Yeah.
same thing with ultrasound technology. They say it's safe, but when you actually look at the studies, there is, effects, especially with the more ultrasounds and the earlier you start having them. And
Oh,
what have
in
we
my
done?
experience, like I said, you can tell when things are going wrong. The ultrasound told me that things were fine, and then my
Right.
actual physical body, things were not great,
They're
but I
not
would have to say
100% accurate anyway, and then they like for, like, higher risk pregnancies like twins, they're towards the end of your pregnancy, they're having you do it, like, 1 a week. It's like so many more. The schedule is just like the vaccine schedule is ramping up the schedule for ultrasounds and
Mhm.
those. Let's just take a peek, let's just make sure during
Yeah,
pregnancy.
that's true,
That's
that's
more and more
true.
all the time. Where even like in the 80s, people weren't always having them. Sometimes they would, sometimes they wouldn't.
Well,
Now, if you say you're not having an ultrasound, people freak out like you're gonna kill your baby.
when I was in England not too long ago, some years ago, but not many years ago, within the past 10 years, I saw plenty of kids with who had Down syndrome, English kids, not like immigrants where they maybe Catholic or whatever, like all the Downs kids who are being born out in California now are Mexican. Or I mean, that's obviously a generalization, but I have a friend who
Yes.
works like on disabled, like special needs babies intake.
Mhm.
And she said, and all she's only English speaking. She said she had 600 intakes and only one Down syndrome.
Wow.
So among like
Yeah.
women whose first language is English here in
Wow.
California. So, and all the
Yeah.
little babies I know because I run into them at the little places my kid goes. They're the Mexican because I believe it's because either because they're Catholic or because they're not getting the
Yeah, if they're not getting
sonogram.
the screening and they just didn't know, or if they are getting the screening, they're
Yeah,
choosing not to terminate, which is
yeah.
great.
But in England, I saw the kids running around. And I said, "Oh, I can tell that they don't include the sonograms in their
Mhm. It's
healthcare
not the sa
protocol."
it's not, if there's a complication, that's there. That's what it was like in the 80s. Like, if you were having some problem, you were like, you didn't feel well or you weren't get your stomach wasn't growing or they couldn't hear the
Right,
heartbeat, then
right.
you're gonna go look. But other than that, it's like
But they changed it now.
now it's
So
just
now they give
yeah,
them the sonogram, so I
yeah.
can almost guarantee you that the birth rate is going to plummet of
And they're
children with
even
Down
doing
syndrome.
ultrasounds as early as, like, 8 or 9 weeks, 10 weeks to just confirm a pregnancy. It's like,
Yeah,
there's other ways to confirm a pregnancy. It's like the lack
yeah,
of menstruation and a
whatever, yeah,
positive pregnancy
whatever,
test.
just yeah,
It's like,
don't pickle it, that's all, like,
just
just
wait.
don't get super drunk.
Yeah.
Stewart says it was illegal in Mississippi, MS is Mississippi, right, where we had our next 2 were at home in Florida, meaning home birth without aid
Home
is
birth
illegal?
with a midwife has been illegal in certain states. So you
Really?
can't legally attend a birth as a midwife. Now, if you know the right people, there's usually underground people that are, like, still
Yeah.
providing services for women, but yeah, wow.
What
Oh,
about water births?
the water births, yeah, I think that's a great option for women. It can
Really?
take a lot of the pressure off because it is, it's like just like when you feel lighter when you're in water. So
Yeah.
I took a bath during my labor when things were intense, but I wanted to get out before I had the baby. People get these birth pools that you blow up and it's heated water. And I thought, I don't want to clean that and
That
have it
is
in the house.
complicated,
And my
yeah.
6-year-old's trying to
You'd
swim
have
in
to
it,
be
when
outside.
I'm getting
Yeah.
ready. So I just didn't want to mess with that.
Right.
So I just took we have a nice bathtub. I took a bath.
Yeah.
But a lot of people like that, and then it's easy cleanup afterwards too. But some of the downside could be if you get your water too hot, that can, lower blood pressure or thin your blood and cause more
Yeah.
bleeding. So yeah, you want to keep a good temperature, but a lot of people like that. And especially, I think a lot of people equate home birth with water birth for sure.
Mhm.
Yeah.
Funny. So, yeah, so what else do you have? Like, how would you I mean, are you advocating for this choice? Do you have any guidelines for people to make this decision for themselves?
Say like if you think you're going to have kids, start thinking about it as soon as you can and just do some research. There is a book I would recommend people reading if you're interested in what we've been talking about here. The book's called Pushed, by Jennifer Block. And it was interesting because the angle she comes from is like kind of a feminist writer. I think she wrote for Bust magazine. And so she was like going into this from a different angle than I definitely was, but I was super impressed with her research and the way she laid that out. And she talks about all these interventions, and she also goes into depth with home births and some of the
What's her name?
risks and benefits. Jennifer Block. Yeah, and The Pushed is the name of that book. She's also got another one called Below the Waist, where she talks about just gynecological care for women and how we are just pushing too much intervention for that as well, which is
Oh,
I
yeah.
haven't finished that yet, but it's great. There's also one called Reclaiming Childbirth as a Rite of Passage from a author with the last name Reed. That one was way more from the midwife's point of view and kind of, I don't know, you could call it hippie or whatever, but like spiritual and like what the history of childbirth has been. I think that was a really good read too. and I think she just came out with it on audiobook, so if you don't have time to read, there's that as well. Yeah. If you're gonna do this, think about it now and think about, um, try to understand the physiological process that your body will go through without assistance and decide if that's something that you can handle. And if it is, then you can start to look in your area for what the laws are in your area and what kind of midwife you might be able to find. Interviewing midwives like early in the pregnancy and not just sticking with the first one you meet if they don't feel
Yeah.
perfect.
Okay.
You really have to trust the person you're going to invite into your space. This isn't just like a doctor's visit, which is you wait for an hour and you see them for 15 minutes. Midwives appointments are an hour to 2 hours. They can come to your house for that, or you can go to a birth center or their office. They're going to be in your house. They're going to know your other kids. They're going to know your spouse. And that's a lot of trust. So you want to make sure that's a person you want to invite in that space and that they're not going to just be the hospital experience at home if that's not what you want.
And did you like that your son was out of the house, your mother didn't stay? Did you
Oh,
like having that? I don't know your
oh, I'm
mother. I'm sure
proud of
she's
him
lovely,
that
but
she was like, "Oh, you're gonna have a home birth, oh?" Like, it's just kinda like, I couldn't do that, you were too
figures.
big. She told me I was too big since I was born, it's like a
Oh,
complex I
great.
have.
That's
I'm like 5
helpful.
almost 5'11", like, "I'm too big." She's like, "You're too big." So, that you had a cone head and they cut you out, what are you gonna do if that you need to do that? I'm like, "Well, I'm not gonna need a vacuum, and if
Right,
we need one, I got one in the closet
right.
right over there, we're fine."
Well, it's very interesting to me that now that I reflect upon it, which I have in other circumstances, but not this one, that some of the things I had perceived to be risks and complications inherent in childbirth actually do seem like they were connected to the hospital experience.
Mhm.
And
Yeah.
I would be very interested in really robust statistics studies like these books. I think would probably be helpful. I would also want to really understand what the biggest risks are and even like really rare risks and exactly how to handle it in the moment,
Mhm.
because I think panicking would would be the is actually probably the greatest risk.
Right, right, and yeah, fear and childbirth do not make good bedfellows, like, you should not.
Yes.
Yeah, you have to not be scared to be able to let the baby out. I mean, think about a cat in labor and they go and hide in the closet or they go out to the barn.
Yeah.
They need to be somewhere where they feel safe and
Safe.
private so that you can open. It's
Yes.
kinda like
Yeah.
going to the hospital to have a bowel movement and them just, like, staring at you and
With the
screaming
door
with the
open
lights on, the
in front
doors
of the
open, and other
nurse's
people coming
station.
in. That doesn't work well.
I will say, I actually discovered something to your point that was very, like, really an intense insight I felt when I had my daughter accidentally, naturally, I mean, in the without any drugs in the hospital. It was really, really painful for me. It was only about an hour of that, but it was super, super painful. And I remember thinking that pain without fear is totally bearable.
Mhm.
That really where I just can't handle something is if you actually think you're bleeding to death
I'm
or
gonna
your kid's
die.
gonna
Yeah,
die. Yeah,
totally.
like, it's the fear that freaks you out, and, but I remember thinking, "Wow, that's interesting." I had no fear whatsoever, which wasn't even valid. I was thinking,
Mhm.
"Why did I have no fear?" Like,
Right.
why did I think that
Well, I
this was
mean,
gonna be
that's
okay?
this we these hormones that our body gives us is to be calm in a way that we can't understand and scare. The child reclaiming childbirth as a rite of passage book talks about these different hormones that come during different stages of labor. And there's ones that kind of take you out of your body. It's like you go, they call it labor land. It's like you leave to go and get your baby and then you come back. It's you're gone for a while and it makes it so that time is not the same as it usually is and passes quicker. So if you go into this knowing that you just need to surrender, that you just need to allow this to happen, it's so much easier for your body to just open and let it happen. Then if you're clenching and you're scared and you're terrified, right? Then your body
No.
gives you this
Yeah.
huge dose of adrenaline right before the baby comes out so that you're alert and ready to, just suck the fluid out of their mouth if they're not breathing and making sure they're okay. And like all of a sudden, like I remember everything from that part. Whereas just before that, it's a little foggy.
I will tell you, Now that I think about it, like 75% of my impression of the dangers of childbirth come from movies like Gone with the
Mhm.
Wind.
Yes,
Like,
there's all of
there's
those
so many
where,
movies where,
you're biting on a spoon, "Get more
"Yeah,
towels,"
sorry,
for some
she's
reason, I
gone."
don't
You
know,
know, it's like,
and then she
"What?"
just dies suddenly and
Yeah,
there's a
she
baby
just dies for
there.
no reason.
Or you can think about even, like, remember the Look Who's Talking movies with, like, John Travolta,
Yeah,
in from, like, the early '90s, '80s
yeah,
or something? That's, like, everything
Chris
about it is
O'Dowd.
just her screaming and being scared and, like, all these doctors and yeah, everything you see in the media about childbirth is negative. It also makes women seem weak and incapable, and that men is where it started, but now
Mm,
hospitals need to take care of them and fix it. And it's funny because women used to be cared for by midwives, and we had better outcomes than we do 100 years later today in the hospital. And so if you look at these things and you see these men walked in and saying, "Well, we need to start to do them." They said, "We have tools, we have forceps, we're cutting," and they didn't ever stop to just say, "What's this physiological process? Let me observe this." Something they've never experienced and never witnessed because it wasn't traditional for men to be in the birthing room. They protected the space. They were in the house,
right.
but
Yeah,
they
yeah,
weren't in with the
definitely.
woman, your sister, your mom, your grandma,
Yeah, my
whatever.
stupid husband with a camera, what the hell? What the hell?
Right? There he is with his tools to fix
Had
everything. He's got his
nothing to
camera.
do with that. That was a
Mhm.
dirty trick, literally.
So
But,
funny.
I was also thinking that the way we have taken total control of natural processes and artificial ways, and we push so my first child, I was 34,
Mhm.
and my body that might not have been the perfect place for me to start, whereas if I had been, more natural process where I would have had a
Right?
baby
Would be
younger.
younger, that's what I thought for myself as well. I was just a month before I would turn 30 for my first one.
Yeah, that's
And
right.
it's, and but women have children from early to late, like, well into
Right,
their
but it's
40s
weird
naturally, but to
to
have a first
start
one
when you're
later is
35,
not
yeah.
that's not traditional, that's not something we've been doing for very long.
Right,
That's
and I
now
just
part
wonder,
of
a
this.
younger body is more supple, it's
Yes.
more flexible, so if you're teaching it how to do this thing when it's young, you can start having babies when you're a teenager. I mean,
Yeah.
when you if you start when you're young, it may train you. So I just I'm rethinking where does natural start? It's like war. People are like, "Well, what about Hitler?" I'm like, "Well, what about World War One? If you didn't
Yeah.
start World War One, we wouldn't have had Hitler." So,
Right. Yeah.
maybe if like I need to expand my horizon on this. So fun and interesting. What did
So
we not cover?
oh boy, I mean, I could have gone into horrible detail of all the other side effects of the induction stuff, but other than that, like, I think you get the gist of it, like, the most important thing is that the woman feels comfortable and in control, and so the in control means you choose how you're surrendering. Are you surrendering to your physiological process in the comfort of your own home, or are you surrendering to whatever is gonna happen to you in the medical system, and you're gonna just live with that, and you're gonna be okay with that? I think if you can come to terms ahead of time that you're making a choice and you have no control really over the actual outcome, and you can just whatever radical responsibility you take responsibility for
Yeah,
whatever outcome there is and have to be with that, and it's sometimes that's easier than others, but I think for the majority of people they're going to end up with a baby in their arms at the end of it, and
right.
they're going to get to go home or
Yeah.
stay
No,
home, and
I
that's a
would
good
say
thing.
really educating yourself. I find that visualizing processes that are new are very helpful. I think that's actually
Mhm.
been proven. Like they did practice
Oh
sports and they
yeah.
they show that visualizing is
Yeah.
almost as valuable as actually practicing. And I would really like to see really trustworthy stats because what I'm thinking now about, so one gal, my sister-in-law's good friend, died in childbirth in the hospital not that long ago, and I asked her why. She's like, "Yeah, just, people die from that sometimes." And I was like, "But why?" And now
Yes.
I'm wondering if, I can't all I could come up with is maybe she had a latex allergy, which again
Or
is
right,
still
or so many of those deaths are after cesarean. The common side effects of a cesarean, just like any surgery, is blood clots, right? So there's tons of complications that come with the big interventions, which the biggest of all is the cesarean. and, the anesthesia with that and
Oh, wow,
all of
yeah.
it, they can accidentally nick a bladder and sew you back up, and you don't
Ah,
realize that that's
ah,
leaking inside of you.
I hate medical
Um,
stuff.
there's tons
I
of
worry about
complications.
aneurysm though, like just spontaneous aneurysm, but I'm not sure they can actually save you even if you're in the hospital or something like that. I don't know.
No,
I really don't know.
exactly.
That's
So many of those things are just like life is precious, and we need to
right,
remember that it's important and that we're not promised another day. We're not
right,
promised a good outcome no matter what. And
right,
that's the false thing that they sell you at the hospital is that you're going to have some halo around you and be protected, and it's not the
right.
case.
You give
And
up a
those
lot. You
Yeah,
give up the natural process in return for rock solid assurance that you're both gonna be okay in the end. And, you know,
it's just not there. They can't
yeah,
do that
you
because
can't
life
really
is just fragile. It just is what it is, the
wow.
nature of it. Yeah.
So, yes, I do. It's like, I've been having such trouble lately on Facebook, actually. Like, they just don't like what we're talking about. And I just have a feeling like it's gonna so please
You
share the show because like my
you
things
said,
my
yeah, there's a lot of trigger words in this
avenues.
one for
It's just
sure.
really like every day I get something from Facebook. I just think I'm not long for Facebook, but
Yeah.
I think about stuff like this, which should be a natural conversation and they I liability stuff like that, people want you to not talk about it, not think about it, not take risks. It's risky to talk about it.
Yes.
you
Mhm.
know so I feel like it is though. I mean, I think that it's those 2 books, for example, Pushed and Reclaiming Childbirth as a Rite of Passage might be a great place to start to educate yourself, and I, for one, check studies, I check footnotes, I
Mhm.
read the original study, a lot of times they go nowhere, so on either
Yeah.
side, so, like, you just have to be like, "Okay, well, that didn't give me the information I was looking for," and just be smart about it because I really don't trust any of the recommendations as being anything but promoting the interests that generate the big money, really.
Right. Yeah. So it's just, it's really you could equate it to everything we went through in 2020. You can equate it to similarly to food or anything else where we're convinced and sold that this truth. And you really start to look at it and you start to dig into it and you say, no, I think they're causing the problem and selling us the
Yeah.
cure.
Have
And
the
that's
courage
yeah, look into
to
it.
to yeah, to seek the truth. There's only one truth. Have the
Yes, or
courage
don't look into it and just accept it, and
or
then
don't,
you
yeah.
go through the system and people survive that too, so it's also fine, but I figure if you're listening to this show,
Yeah.
then you're somebody who wants to look into things a little
I
more
did
and
not think I would walk away from this conversation at all moved from my original position, which is, thank God I was in the hospital. I don't like pain anyway. Like, I wouldn't have done anything differently. And now I'm like, you know what? I would have well, the Downs kid, but there were signs were there. Even though they
but
told me I didn't
yeah,
have Down syndrome, like
it
I
was
had complications before it even
right?
got
And
anywhere.
having your water broken for a month before, you're
Yeah.
leaking. It's not like on the movies where there's just like a bucket of water on the floor and you're slipping in it. It's like it just starts leaking and your body produces more amniotic fluid, so you
Right.
can still
That's why
maintain.
I
Yeah,
just was at an angle
just had to
and
lay
it
down.
just stayed in
Yeah.
there,
Mhm.
and it was but that was, that was a medical those kids, I'm not sure. There's probably a high, fatality rate among, kids with genetic abnormalities. I don't
Well, they
think.
don't let you do that anymore. They wouldn't let you let the baby keep growing. They would immediately remove it. And so that's a big difference too. And then the baby has all sorts of problems because they're taken out too
Oh,
early.
yes, no, it really what a good doctor he was,
Yeah.
Doctor Thurston in Dallas. But even with my daughter, and then when I went with my 3rd child, I was like, "I absolutely have to have an epidural. I want nothing to do with that pain." And the doctor, he was a substitute doctor, who's like whom I did not know, he's like, "Why don't we just give you a C-section?"
Yeah,
It's
let's
like,
just get
"What
in
the
there and
hell?"
take care of it. We'll do a
He
tummy
had
tuck while we're in there.
right.
That's what they say. It's
I was like
insane.
and he had already given me some kinda drug, I don't know what it was, and I was like, "I don't know." My husband was like, "No,
Yes,
no."
we're good on the major
Yeah.
abdominal surgery.
What are
You're
you
just like, let me
talking
just saw
about?
into your wife here. It's
No,
fine.
I think he was like he just wanted the money, it was,
He's just like to be
crazy.
done. Then you can schedule dinner tonight.
Oh,
It's like
oh,
you can't
yeah.
schedule physiological labor
It was a
processes.
Saturday.
He wanted to go home. He wanted to go to
Yeah,
the friggin' golf tournament
it
like
was a
those
Saturday.
other dudes. Yeah, so, I
Snap.
mean, there's incentives, more than a lot of angles of incentives for C-sections. I mean, in other countries like Brazil, they have, like, an 80 or 90% cesarean rate, and those are
Well, that
scheduled
is
C-sections,
probably
elective.
a combo pack with the tummy tuck.
That yes, that's
I know some Brazilians, and they're like, "Why would you
it
not do
yeah, they're
that?"
like, "I don't wanna destroy my body, just take it out," you know?
Right, right, right,
But
right.
that's been sold to them over a long period of time, and it's just not a good thing, and then, I don't know, I'd love to look at their rates of, like, how many of their kids have food allergies and other things like that, because I think, with any major surgery, you're also given IV antibiotics
Mhm.
and all of the other things that
And the
go along with a major
pneumonia.
surgery, and then having to heal from that, and then, yes, yeah, not having them have their lungs compressed like they're supposed to on the way out. It's a
Yeah.
huge deal.
Interesting.
Yeah.
So tell people how they can find more of your wisdom on
Oh.
a variety of topics.
So you can listen to my podcast, the Greener Postures podcast. I did have a recent episode, which they're far and few between right now because I'm kind of taking a break. But I had a lady on that is in the Czech Republic that chose to have a free birth for her second. So she chose to birth alone and not have an attendant there. And it's a beautiful story after having a traumatic first birth that started as a home birth with midwives that talked her into going to the hospital and having a C-section because she was just kind of tired from labor. So it's a good story. And then if you are interested in fermentation, food preservation, and all that, you can find my website, preservingtoday.com, or please follow me on YouTube, subscribe to Preserving Today on YouTube. That's where I'm putting most of my energy these days into videos that I'm making about fermentation and food preservation.
I'm so excited that I got my giant sauerkraut crock for Mother's Day.
Yes. Oh, that's a
I'm
beautiful one too. Yeah.
super excited. Yeah, so I haven't dug into that yet because I'm intimidated by my new little microclimate that I live in that seems to like to absorb all my brine,
Yes.
but I'm gonna have some
Watch
fun with
it.
that.
Add more brine.
Yes, I'm ready. You told me how to
Put
fix it. I'm
extra.
totally
You
yeah,
got it.
I'm totally gonna do that.
Beautiful.
So that's fantastic. I am Monica Perez. This was stimulated by my latest endeavor, which is on Tuesdays and Thursdays at 2 o'clock Pacific, 5 o'clock Eastern. I still can't get the New Yorker out of my in
Right.
Atlanta, but where I just go through stories that I find, try to do the top headlines of the day. I found an interesting thing about this topic, and it caught Lanny's eye, and here we are with this great and fruitful conversation. So thank you very much for that. So you can find me here and on the wherever you listen to your favorite podcasts. And you hang on a sec, Lanny, because I want to make sure your thing is uploading.
Great.
So thank you so much, everyone, for coming. I love doing it live. I love having the little chat. I really appreciate it. It's like my moment of sanity in here in Southern California. I am not the master of my own domain. Other people have a vote. So until next time, thank you so much.
Thank you.